Welcome to another episode of Correcting the Secretary. On Wednesday, RFK Jr. was testifying to the Senate Finance Committee and claimed that the measles epidemic is global and has nothing to do with him. Listen.
Canada has been lost its elimination status. England has lost its elimination status. All across Europe, they've lost their elimination status. It has nothing to do with me. It has to do that we have a global epidemic.
Saying that the measles epidemic is global is missing a critical point about how infectious disease, and especially measles, work. Measles is one of the most contagious viruses in the world. It spreads through the air and can remain in a room for up to 2 hours after an infected person leaves. Because of its contagiousness, even small drops in vaccination coverage can quickly lead to outbreaks. Measles requires about 95% vaccination coverage to maintain what's called herd immunity. That threshold protects people who cannot be vaccinated, such as infants, cancer patients undergoing chemotherapy, or individuals with certain immune disorders. When vaccination rates fall below that level, the protection for the entire community weakens. As those rates drop, the risk of outbreaks rises. That's not theoretical. That's not fear-mongering. We have seen data. It is happening. The United States declared measles eliminated in 2000, despite measles spreading globally, meaning there was no continuous spread within our country, even though there were measles epidemics in other places. Outbreaks have returned to the U.S. not because it's spreading globally, but because our vaccination coverage has fallen. International travel means that cases can be imported here at any time. And when vaccination coverage is high, those imported cases remain isolated and outbreaks do not occur. Public health messaging around measles has also decreased under the CDC. Strong vaccination campaigns historically played a major role in keeping coverage high and reminding parents about the importance of the MMR vaccine. When public health communication weakens, while vaccination rates are already declining, it creates conditions where outbreaks are more likely. So while measles is indeed a global disease, he's right about that, the virus only spreads where immunity is low enough for it to take hold. If the CDC continues to ignore what's happening and vaccination rates continue to drop, we should expect to see more cases, more outbreaks, and more death and disability from measles in the future.